Basic knowledge about suturing is one of the essential skills for medical students and paramedics. For this, we need to have a sound knowledge of suture materials and needles. Needles can be of various shapes and sizes. The needle is made up of three main parts: the eye, body, and point. The eye is where the suture attaches to the needle. This can be an actual needle eye, where the string threads through, or a point where the suture thread gets swagged onto the needle. Most modern needles are of this latter type. The body is the most substantial part of the needle and connects the eye to the point and determines the shape of the needle. The needle can be straight or curved, which is more common. Due to the risk of needle stick injuries, straight needles are rarely used. The circle of a curved needle comes in different lengths, but most curves are a quarter, a half, 3/8, or 1/3 of a circle. The curve is vital in helping the surgeon know where the tip of the needle is at all times. Most skin closure sutures are curved and usually 3/8 of a circle. A half circle is used for bowel suturing. J-shaped needles for deep confined spaces. Amongst needles, there are different types based on the needle tip, mainly cutting or taper needles. Taper needles are rounded and can be either sharp or blunt. They work by piercing the tissue without cutting it, essentially spreading the tissue as it passes through it. These are good for soft and delicate tissues and tendon repair. Cutting needles have a tip with three sharp edges. A conventional cutting needle has the cutting surface inside the needle, that is, apex of the triangle is towards the inner side. And a reverse cutting needle has a cutting surface on the outside of the needle. Reverse cutting needles are commonly used for sewing skin. Needles come in various sizes. Generally, larger suture materials come with larger needles. You can see the size of the needle on the packaging. Since we are looking at the packaging, let's look at the details of the needle. So this needle is 3/8 curved with a reverse cutting tip. The thread is swagged and the needle size is 45 millimeters. In the next session, we shall discuss sutures. Please subscribe for more useful content.